Because they open up the stores does not mean that customers will actually show up. Thank you, Priscilla. That's NBC's Priscilla Thompson reporting from Houston. This week has raised new medical questions about how we can defeat coronavirus. Let's discuss them with Dr. Lipi Roy, an internal medicine physician and MSNBC medical contributor. Dr. Roy, it's good to see you.
You too, Joshua.
And we are in the room. We are in the same room.
A miracle. Amen.
A vast building. And now, thankfully, there is more than just me and the floor director. I am so happy.
Yes.
Let me talk to you a little bit about this analysis from CNBC. They analyzed the World Health Organization's daily COVID-19 situation reports. And CNBC found that yesterday the U.S. had more than 2,900 deaths in 24 hours. That's the highest daily death toll in the U.S. It is worth noting that the overwhelming majority of people who do get COVID-19 tend to survive. But in light of what we've known and what we've learned so far, what do you make of these states reopening?
Yeah, so if you really just look at the data, just look at the trends, the number of cases, the number of deaths in this country continue to go up, right? We're not really seeing on a national level any kind of plateau, and most certainly not a decline. So if you just look at those statistics, it tells me as a doctor and as a public health professional that it's just not really safe. And remember, we also don't have widespread testing. So the state leaderships that say that, oh, in our state or in our county, we just don't, it's not that big of a deal. Well, what's that expression? You don't know what you don't know, right? So if you don't test your constituents, then how do you know that you don't have a problem?
With regard to it not being that big of a deal, a number of the protesters we've seen, not all, but some, have said that the U.S. didn't power down this much during the Spanish flu back in 1918, which is false. The U.S. did have some measures that are kind of akin to social distancing. A number of businesses did shut down, so that is incorrect. Let's share a piece of a 2007 study from the NIH about that pandemic. It reads in part, quote, cities where public health officials imposed multiple social containment measures within a few days after the first local cases were recorded cut peak weekly death rates by up to half compared with cities that waited just a few weeks to respond. It goes on to read, quote, the second study also shows that the timing of when control measures were lifted played a major part. Cities that relaxed their restrictions after the peak of the pandemic passed often saw the reemergence of infection and had to reintroduce restrictions, unquote. So does that give us an inkling of when and how we will know if states opened too soon or got it right?
Yeah, so one of the key pieces to remember, if the folks are going to look back at 1918, and I recommend that they do, but make sure that they don't pick and choose or cherry pick the data, because the cities back in 19 that had the lowest mortality rate practice the most stringent social control. So this idea of physical or social distancing and contact tracing, these terms that we're using very commonly now, these are not new. We have been using these terms and these public health tools and measures for as long as human beings have existed, because that's how long epidemics have existed.
There's plenty of concern about a potential second wave. We're still in the first wave, but what do you think that second wave might be like if there is one?
Yeah, I mean, it's hard to predict, and that what that wave will look like will be determined by how we act now, right? So if we continue to practice really stringent physical distancing, the hand washing, the staying at home, the wearing masks, these are tried and true preventive health measures in the absence, remember, of widespread effective treatment, prevention, and cure. So right now, if we continue to practice those measures, it's possible that the wave will not be so bad, but remember, we may very well have a summer wave as well as fall, when we're also going to have influenza. So that's flu season. We know that's coming. So it's going to depend a lot on how this virus acts in terms of seasonality and in terms of what we do as a nation.
In terms of those treatments, there's this medication Remdesivir that I definitely want to ask you about. The FDA granted emergency use to use Remdesivir on severely ill patients. Dr. Anthony Fauci said he feels really good about it. It's one of the few drugs that we have a large survey sample, double-blind, placebo study on. What do you make of Remdesivir?
Yes, Dr. Fauci, though, also added cautious optimism, and he made sure to be very clear that this is not a cure-all. So, and to your point, Joshua, it's been studied and been shown to be effective really in a small subset of patients. patients. So these are patients with severe COVID-19 infection, and it's been shown to reduce hospitalization in the ICU stay from 15 to 11 days. And that's promising, right? The fewer days you can stay in the ICU, the better. Last Christmas, I went to visit my parents in Toronto, and my father was in the ICU for respiratory conditions, and we were begging the doctors to let him out just a little earlier. Obviously, I know as a doctor, it's based on clinical outcomes, but the fact that he was able to make it home just before Christmas was meaningful. So I really get that sense of hope and optimism, and the fact that 4 days is better than nothing, right? But it's really important to remember this has only been shown to provide some clinical improvement in severely ill patients, and again, in a subset of people.
Can I tell you how much it does me good to just be in the room with another person?
I know, right?
I would give you a high five if it was safe to touch. There you go. Dr. Lipi Roy, MSNBC medical contributor. It is good to see you in the flesh. Thanks for making time for us.
Right back at you.
Your cell phone tracks where you are and what you do. Should we let it help us track COVID-19? We'll weigh the benefits against the privacy concerns. Just ahead, stay close.